Hello, in this video we will discuss about the glomerular nephritis. There is a lot of complication due to the glomerular nephritis. Glomerular nephritis is disorder of glomeruli. What is glomeruli? This is the cluster of microscopic blood vessels in the kidney with small pores through which blood is filtered. So the glomerulus will be problem characterized by body tissue swelling, and in this way the swelling will lead to edema and due to the water retention. So the characterized by body tissue is swelling. Swelling will lead to edema. Basically the swelling is the edema. High blood pressure is due to the water content increase in the blood and increase the volume of the blood vessel, and the presence of the RBC in the urine is also characterized the glomerular nephritis. Glomerular nephritis name is so because the glomerulus are involved. This is the glomerulus and this is the Bowman capsule, proximal convoluted tubule, loop of Henle and distal convoluted tubule to the collecting duct. This is the afferent arteriole and this is the Bowman capsule. Afferent arteriole toward the glomerulus, while the efferent is used for the reabsorption away to the glomerulus. So this is the pores which that will lead to loss of the protein, and this loss of the protein will not reabsorb, and in this way the protein containing urine formation will occur. The symptom is the tissue swelling and edema, the major. But on the other hand, the blood pressure increase. When blood pressure increase, the flu-like illness, the 50% should be. Kidney and control the blood pressure regulation, and weakness will occur. Weakness will lead to fatigue, fever, and common. But on the other hand, the loss of appetite, nausea, vomiting also occur but rare. Abdominal pain and joint pain will be occur also due to the loss of the sodium, loss of the calcium and potassium. This is the urine which that is contain protein. Albumin is known as a proteinuria. This contain protein containing urine. The loss of potassium due to the nervous system effect, and loss of calcium, the fatigue in muscle, loss of the sodium normally, loss of protein imbalances of ions. Let's begin to understand the imbalances of homeostasis overly. This is the blood circulatory system and this is the tissue. Blood circulatory system, when the decrease of the albumin negative charge containing, so the whole homeostasis will be changed. For example, in the tissue, the sodium when increase due to the blood circulatory system will lose the sodium due to the albumin negative charge containing less, and the water will increase due to the increase of the sodium in the cell will lead to swelling the cell of the tissue, lead to edema. When decrease of the potassium due to the loss of the potassium more in the urine due to the reabsorption impossibility, and the cell injury and necrosis of tissue will occur. When the potassium loss due to the potassium will loss due to the reabsorption impossible due to the pores which that will more loss of the potassium. The primary involved the glomerular nephritis is the kidney, while the secondary is the other organs. Let's begin to understand the causes. The infection, the genetic disorder, and autoimmune disorder. The autoantibody will produce, which that collapse the glomerulus will damage. Prognosis is the acute infected can be resolved in most cases, children 1% and adult 10%. Let's begin to understand the acute glomerulonephritis. The acute glomerulonephritis is due to the strep A throat infection, staphylococcus and pneumococcus, or viral infection like chickenpox or malaria. Non-infectious disorder also involve like membranoproliferative glomerulonephritis, immunoglobulin A IgA nephropathy, cryoglobulinemia, good posture syndrome as the granulomatosis, and polyangiitis. Anyhow, let's begin to understand the further classification of the glomerulonephritis. To understand the causes, so this is the glomerulonephritis, which that be classified into the immune complex, anti-glomerular basement membrane, anti-neutrophilic cytoplasmic antibody associated, and C3 glomerulopathy. Anyway, let's begin to understand further via a classification of the immune complex first. Immune complex glomerulonephritis is due to the lupus, the lupus nephritis, infection-related IgA nephropathy, and fibrillary glomerulonephritis, and the cryoglobulinic and idiopathic rare. But in this case, the anti-neutrophilic cytoplasmic antibody associated will lead to proteinase 3 associated and the myeloperoxidase associated. The C3 glomerulopathy is the C3 glomerulonephritis and the dense deposit disease, while the monoclonal Ig associated is the monoclonal Ig deposition, immune tactoid, and the cryoglobulinemic monoclonal. This is the autoimmune disorder also involved. Will lead to high blood pressure due to swelling of the endothelial and other tissue to get less space for vasodilation. So the vasoconstriction will occur, will lead to high blood pressure, and the heart rate will increase, and the heart output will be decreased while the input will be increased. Will lead to hypoxia also. Anyhow, let's begin to understand the treatment. Basically, the treatment, the causative disorder, the rapidly progressive glomerulonephritis, suppression of the immune system, ACE inhibitor and the ARP, and the sodium will loss. A decrease of the sodium will lead to treatment. The diagnosis we will discuss if the blood test is the number one, and when the blood test will be used, and the urine protein test and biopsy of kidney. These are three diagnosis tip for glomerular nephritis identification. If the test is positive, it means the glomerular nephritis is positive, while the negative, so we can find another complication if the glomerular nephritis will not occur. So thanks for watching. If you like this video, please make sure to subscribe, like, and share. Bye for this time.